Hi friends, I'm Jonna B. I'm an occupational therapist and a researcher and an educator, and welcome to OT Translated Occupational Therapy Education for Every Day. Today we're going to be answering a really important question together. What even is occupational therapy? It's a good question and it has a pretty broad answer, so we're going to hopefully break it down a little bit together today so that you have a better understanding of who an occupational therapy practitioner is and what they might be doing. So according to the American Occupational Therapy Association, occupational therapy is the therapeutic use of everyday life occupations with persons, groups, or populations, we refer to them as clients, to support occupational performance and participation. Not sure that really answered our question as to what occupational therapy is, so let's break it down even further. Occupational therapists really focus on occupation, so think meaningful activities, how someone occupies their time. In occupational therapy, we have 9 main areas of occupation that we focus on. The first one are activities of daily living, known as ADLs. Instrumental activities of daily living, known as IADLs, health management, rest and sleep, education, work, play, leisure, and social participation. And as occupational therapists, we can work across a variety of different settings to address these meaningful activities. We can work in hospitals, clinics, nursing homes, schools. We can work throughout the community in home health, in nonprofits, and even consulting for corporations. What the focus is of occupational therapy across the lifespan is, again, how an individual is occupying their time in meaningful life activities that they need or want to do. So as occupational therapists, we're really helping to increase functioning. For our clients, that might look like independent functioning or interdependent functioning. But regardless, we help clients to reach their fullest potentials. Sounds pretty great, right? Some examples of ways that you might see occupational therapists working are in an acute care setting. Maybe an occupational therapist is helping a post-stroke client learn how to dress independently again. Maybe an occupational therapist is working in an elementary school, teaching teachers how to create sensory-friendly environments within their classroom for all students to thrive in. Maybe an occupational therapist is working in a community-based setting like a homeless shelter, helping to create programming about healthy habit formation for residents. Regardless of how you see an OT working, we all bring the same lens and approach to practice. And this is a holistic lens, meaning that we're thinking about the whole person and the whole picture. So the person and the environment in which they are trying to function. So those person aspects that we're going to focus on are performance skills. We're going to think about sensory motor systems, cognitive systems, and psychosocial systems, and how those different skills play a role in functioning. We'll think about performance patterns, think habits, routines, roles, and rituals in which someone is engaging in different meaningful activities in. And then we think about the context in which someone is trying to complete those meaningful activities. So it's really like being a professional problem solver to be an occupational therapist. We are not necessarily solving problems for our clients, but we're coming alongside them in our practice and really helping to facilitate what they need to and want to be doing in life. And I think that's such a beautiful and a special thing. I think that occupational therapists are some of the most special people that I have met. If you are a student interested in an allied health or a healthcare career, I strongly encourage you to do a little bit more research on your own as to what occupational therapy is and if it might be a career path that you'd be interested in. If it is, check out some of the other videos on the OT Translated channel to learn more about how you can become an occupational therapist. Well, thanks for joining me today. It's been a pleasure, and I look forward to working together with you as we continue to spread occupational therapy education every day. Thank you for watching this video today. If you enjoyed it, don't forget to like it and subscribe to the OT Translated channel. Join us next time for more occupational therapy education for every day. Take care, and I'll see you next time. Bye.